In neonatal intensive care, one of the most common things we have to do is support the breathing of preterm and sick neonates, and a lot of my research has been around ways to do that effectively or optimally. I'm Brett Manley. I'm a consultant neonatologist at the Mercy Hospital for Women here in Melbourne, Australia, and previously at the Royal Women's Hospital in Melbourne for about 15 years. I'm also a professor in the Department of Obstetrics, Gynaecology and Newborn Health at the University of Melbourne. I'm incredibly lucky to be in the position to be both a clinician and also have part of my job that is undertaking research. I remember coming up through my clinical training as a paediatrician and a neonatologist. I never thought I wanted to do research, but my bosses dragged me in and made me do a small project, and somehow I seem to have caught the bug. I just love collaboration. I love meeting people, organising clinical trials and research, and then seeing that through to fruition, which is just incredibly rewarding, especially if you manage to find something that actually helps the health of your patients. So I'm so lucky to have both those strings to my bow, with funding from the NHMRC here in Australia to actually fund my time to undertake research. And my passion is leading and collaborating on clinical trials, particularly randomised controlled trials, to improve the outcomes for sick and premature neonates. In neonatal intensive care, one of the most common things we have to do is support the breathing of preterm and sick neonates, and a lot of my research has been around ways to do that effectively or optimally, especially less invasive ways of providing respiratory support. So trying to avoid the mechanical ventilator, which we know over time is harmful to the fragile premature lungs of these babies, and really find the best ways to support their breathing through nasal or less invasive interfaces such as CPAP, continuous positive airway pressure, or nasal high flow. And I've now been part of 4 large randomised controlled trials looking at nasal high flow and how that might be best used both in the NICU and also in the delivery room, and for supporting procedures like endotracheal intubation. My biggest undertaking to date has been the PLUS trial, which is a large international multi-centre randomised controlled trial of intratracheal budesonide. That's a corticosteroid given directly into the lungs of extremely preterm babies using surfactant as a vehicle to carry it into the lungs. This trial was on the back of previous small trials showing great promise with this therapy in increasing survival without bronchopulmonary dysplasia, BPD, which is the chronic lung disease of extreme prematurity. So we undertook what we hoped would be a more definitive trial. It involved 21 NICUs from 4 countries, Australia, New Zealand, Canada and Singapore, that recruited over 1,000 extremely preterm infants born before 28 weeks of gestation. So it's a highly powered trial to show whether intratracheal budesonide would in fact increase survival free of BPD in a clinically meaningful way. Unfortunately for us and for the babies we look after, we found no significant difference in the incidence of survival free of BPD with intratracheal budesonide mixed with surfactant compared with just surfactant on its own. So that was a big disappointment, but nevertheless, negative trials are important as well. It makes us stop using ineffective or harmful therapies and also pushes us in a new direction. But it was a huge learning point running such a big trial involving so many centres. It took 5 years to complete enrolment, as these neonatal trials tend to, because they just require so much collaboration to get the numbers. And I've learned a huge amount from that randomised trial, and will now take those learnings into new research. I work across several institutions here in Melbourne, Australia. Currently Mercy Perinatal and the Mercy Hospital for Women, the University of Melbourne, and also I'm an honorary fellow at the Murdoch Children's Research Institute in Melbourne, Australia, and all have contributed to funding and getting me started with my research. But in particular, my trials have been funded by large-scale government grants, in particular the NHMRC, the National Health and Medical Research Council, and also the Medical Research Future Fund here in Australia, which are sort of the go-to place to fund large clinical trials. Neonatology is the most incredible specialty. It's truly life or death scenarios most days that you're working in the neonatal intensive care unit, or of course attending resuscitations in the delivery room for sick newborn infants. Not only do you get to really be involved in the care of your patients and making lots of intensive care type decisions, but you're also continuously working with an incredible group of colleagues, your doctors, nurses, allied health collaborators, but also the families that are at the bedside, where you're undertaking this continual dialogue even before the birth about what might happen, and then during the infant's stay in intensive care. And then at the end of all of that, when things go well, you get to see these babies go home completely changed from when you first saw them, and then follow them through to early childhood and see them grow and develop. And it's just incredibly rewarding. Well, between the clinical work and the research work, honestly, I'm pretty busy, but I've got my passions. I've got 4 kids who are primary school and early high school age that keep me very busy. So lots of bike riding, trips to the park, and hanging out together. And I'm a passionate AFL supporter, so I'm a Western Bulldog supporter. For those of you from overseas, that's the Australian Football League. We've got our own brand of football down here, and so I try and get to as many games as possible on the weekends.